talking about anything to do with lockdown, anything to do with the problems with the hospitals and the like, we constantly come back to it's the problem with testing and test and track and trace, and that we're not testing enough people, we're not testing enough of the right people, and we're not getting those test results back. Is that the problem?
No. Good morning, everybody. It's really, it sounds counterintuitive, but in my opinion, you don't chase respiratory viruses around the country using industrial molecular biology. I don't think we should be testing anybody unless they turn up to a hospital. And even then, we should be doing it better than we're doing.
And when you say doing it better than we're doing, you and I have spoken a number of times about false positive rates and things like that. There's still an ongoing issue, although, again, I get fact-checked by the BBC when I ask the Health Secretary about this, saying, this is all completely debunked. But we know many, many eminent people, scientists and academics in this field have questioned this. The big issue here with the false positive rate, and it'd be helpful if you could explain what that is for my listeners who aren't immersed in this, is that it would appear that no one actually knows officially what it is. But tell us what it is and why it's so important still.
Yes. Okay, so just briefly, this PCR or polymerase chain reaction, it's an amplification technique where bait, which is humanly designed, is popped into a sample, and then it goes into a machine that cycles it over and over and over again up to maybe 2 to the power of 40, an enormous number. And the power of it is you could find one molecule in the swimming pool, or not quite, one molecule in a sample you could certainly find. And the problem with it is it sometimes produces a signal at the end when there's nothing in it at all. That's called false positives. Also, it can be positive when there's an after infection, broken pieces of viruses or things that are similar to what you're looking for. Bottom line, as you said, Julia, the government has now admitted in formal written answers to Parliament, so it's in Hansard, that they have not characterised it. They do not know what the false positive, false negative rate is. And I'm saying, please, your listeners, the test is not to be trusted. Everything they're telling you about, cases, admissions, people in ICU and deaths, all pivot off this PCR test. And I'm saying it's impossible to know whether all of the positives are real or none of them.
Well, what about the people who criticised you, people who criticised me? And again, I'm just reporting on what the experts are saying. I don't pretend to have expertise in this area and never have. That okay, when you've got a very low prevalence of the disease, as we had in July and August, and then you're going to see far more false positives because even with a very low rate, say 0.8% of them are false positives, which is the normal figure for these sort of kinds of tests. If you've got a much lower prevalence of the disease, then you're going to have 90% of them are going to be false. However, when the disease is on the rise and you've got a much higher percentage of people with the disease, the R rate is higher, then you get a much lower false positive rate. And hey, if the false positive rate was as high as you said it was, we wouldn't be seeing all these people going into hospital now, and we wouldn't be seeing this rising COVID deaths. What do you say to that?
I'm sorry, I have to push back on it. People saying the R number. The R number depends on the PCR test, which I'm telling you is unreliable. More COVID patients going into hospital depends on the PCR test, which I'm saying is unreliable. Even the people operating it could not stand in front of you and say what percentage of the positives are genuine. I think some of them probably are, but no one knows.
Well, of course, of course some of them are. But
and Julia, if I may say, you said now the virus is rising. We've no idea if the virus is rising. Might be. In fact, I would probably credit it with a small seasonal bump along with 4 other potentially cross-reacting common cold-causing coronaviruses. But there is no evidence that it's rising. And definitely, Julia, you know this, the illness and deaths data says it's not. It's a respiratory virus. There are no excess respiratory deaths in autumn, none. There are no unusual levels of admissions to ITU based on respiratory illness. That, to me, says it's not here.
I mean, this is it, isn't it? When we see these stark figures and they're reported in very sort of ponderous tones on the television, we've had, 500 more deaths or 400, whatever it is on any given day. Often, actually, if you dig into it, you look at actually over the days in which they've actually been, the date of death as opposed to reported death. Actually, we're looking at far lower numbers. But also, these are deaths with COVID, not of COVID. So you can be in hospital for a whole variety of other reasons. You can have heart disease, you can have cancer. If you test positive for COVID, you still end up on these statistics, don't you?
And see, this is what I'm saying. Everything you're being told, every scary fact and prediction from Whitty and Valence, all hangs off the PCR test, which they have admitted they cannot tell what percentage of positives are false and true. Let me say, I'm going to make a strong statement. Everybody should comply with the law. I don't want anyone not to. But that space does not extend to the space between your listeners' ears. I am saying the pandemic is fundamentally over in the UK. I'm more sure of this than ever, and we should not be doing anything. So here's the two reasons. Apart from the illness data and my problems with the test, two other reasons. The theory says so. We now know that loads of people had prior immunity. There's an unbelievable amount of data. Whitty and Vance have ignored it. And then when people are infected and they mostly survive, they become immune. That's not a theory. That's how it works. And so as a result, I believe we are now firmly at community immunity. So that's one thing. Remember, they keep talking about second waves. That's got my hackles up. I'm afraid, dear listener, viruses don't do waves. You must go and look it up. And if I'm right, that means they've made it all up for I've no idea why. I'm sure they're well-intentioned.
This is the bit that people don't understand. Why
Yeah.
are they telling us data? I mean, even when we saw on
Yeah.
Saturday night, this figure, this 4,000 deaths a day from this was debunked within hours.
Yeah, it's
This
nonsense.
was then presented by the Prime Minister yet again in Parliament on Monday, even though it had already been debunked, and it was debunked by Professor Carl Hennigan and others, pointing out that this was old data. It was already untrue at the point in which he spoke about it, and it's not a matter of opinion untrue, mathematically disproven, and yet we're still being given these sort of statistics. Why do you think that is?
Well, for a start, I will say at this point, Julia, I don't know. I'm a scientist. I can tell you what they're telling you is incorrect. Furthermore, and this hurts me to say it, they're clever people. I absolutely know that they know what they're telling you is not true. So there must be a reason. I don't know. I'm not a detective. I'm really not. Could it be about money or whatever it is, the reset? I've no idea. I'm telling you, they're telling you untrue things. Can I just give one last example? Yep. As to why your listeners will know I'm telling the truth. So I've said theory says so, illness and death says it should be over, and the PCR test is unreliable. The people's practical experience says so. How long does a seasonal flu epidemic last in the UK? And the answer is probably 3 or 4 months. This virus is more infectious. It can't take less time to go through the population. So I think from February to June, it was in the land. That was where we saw the excess deaths, and then it went. And it doesn't come back because viruses don't do waves. Now, one last thing. Do you know last week, Julia, everybody was going on about antibody levels and how they were falling. And I heard the spin that I couldn't believe. They said, this means the immunity doesn't last long. No, that's a wrong interpretation. Immunity to viruses is mostly conferred by what's called T memory cells. Antibodies are probably not very important, but this is the key thing. As I saw antibody levels falling and falling, human body is very efficient. It doesn't keep making antibodies that it doesn't need. What this data is telling us is that people aren't being exposed again and again and again to the virus. That's why the antibody levels are falling. Okay. It perfectly fits my thesis.
Mike Yeadon, we'll have to leave it there. Point out he's a former vice president at Pfizer. He's a former chief scientific advisor there. He was actually a person looking at respiratory diseases. This is what he does for a living. He's a scientist. Thank you very much indeed. I really appreciate you joining us. This is Talk Radio.